Good afternoon, everyone, and welcome to today's edition of Black Health Trust. We are so happy that you chose to spend this hour with us, and we are going to launch right in on a topic that does not get enough light shown on it. And we at Black Health Trust, as always, want to try to get the information out to our community. Without further ado, I'll turn it over to our founder, Dr. Randall Maxey.
Good afternoon, everyone. Thank you for joining us, and welcome back to Dr. Walks, who went down under to the place of New Zealand. Thank you, Dr. Neighbor Stevens, Dr. Lawson, Dr. Hines. We have a subject we're going to speak about today that we've had before. It was so good, we had to do it again. We're going to feature Dr. Tamora Dixon. Simon, can you roll the video, and we'll invite her to have a few words afterward. But now let me move to introducing our distinguished speaker this morning. Her name is Dr. Tamara L. Dixon, DDS, Doctor of Dental Surgery, and she deals with oral health and wellness, and as well sleep health and wellness. And she's located here in Los Angeles on Sepulveda Boulevard. So Dr. Dixon is a cosmetic and wellness dentist. She's been in private practice in the LA area since 1994, the year I was born. She's also known for using the highest standard of care and most current techniques in delivering aesthetic dentistry for her patients. She specializes in oral systemic health, dental cosmetic procedures, orthodontics, and orthopedics, and dental sleep medicine. I'm going to ask her about that. I don't know what that is. And she deals with sleep apnea. She also provides advanced antimicrobial periodontal treatment with an emphasis on improving overall systemic health. And what we've come to learn is that the oral cavity affects your mind, it affects your cognition, it affects your heart, your blood pressure, and your brain. She got her BS degree, bachelor's degree from the University of Southern California, and she attended dental school at University of California, San Francisco. She received a doctorate in dental surgery then, as well as a bachelor's in dental science. She's taken extensive continuing education courses in orthodontic, orthopedic treatments, dental cosmetics, dental implant restorations, periodontics, and sleep apnea. I need to go see her real quick. So she also took a sabbatical from a private practice to dental research. And during this time, she was a full-time traveler across the United States dealing with oral health. She also was an examiner for the CDC and for NHANES health, which and nutritional examination, which we quote often. So I bring to you now, for your listening pleasure and learning, Dr. Tamora Dixon. Dr. Dixon, the floor is yours, and welcome.
Thank you so much. I was thrilled to be here. I didn't know that it was going to be like on YouTube and stuff like that. But I'm so excited to share this information anytime I can get a chance to do it with physicians, especially. I would go around and take photos to physicians and try to explain about oral systemic connections and stuff like that. And a lot of times they would just say, well, you know, my patients have Medicare, or they don't, they can't come, or, you know, I don't know. I don't know what it is, where the disconnect is, but we're going to connect it together and get this bridge going. The American Heart Association suggests that you do have someone in the dental profession that you can refer to that knows about biological connections. So as Dr. Maxey said, I'm in Westchester on 8610 South Sepulveda Boulevard, and that's on the corner of Manchester and Sepulveda near LAX. And this is my information here, my website, and my email address. I'm gonna do can you guys see the slides?
Yes.
Okay.
We can
So
see them.
the first thing I'm going to talk about is
Dr. Dixon, can you hit the slideshow button? Then it'll be a little bit bigger for us.
okay. Okay, there
So
you
the one, here we go. Yeah.
go. So the first slide I want to talk about is one of the main things that we find dental bacteria everywhere is from gum disease. So when you have inflammation around your gums, a lot of people will have bleeding gums when they brush their teeth, or their gums will be swollen and feel thicker and redder. And so those the bacteria that's in there travels throughout the body, and they find them in all kind of diseases, from heart disease to rheumatoid arthritis to pancreatic cancer. I mean, there's a lot of different diseases that they find this bacteria in. This bacteria is different in everybody. It's just like DNA. So it's different in everybody. We have tests that we do to see which ones you have and how aggressive it is. Some people don't have bacteria that's really aggressive, so they won't lose a lot of bone. And some people just lose a lot of bone and it'll be aggressive. And whatever it's doing to the gums, it's doing inside of your body as well. So it doesn't stay in the mouth. It's an infection. Like people will say, oh, I have gum disease, but they don't realize that it's an infection that affects your whole body. There's research that shows that it's a bidirectional relationship with periodontitis and diabetes, for example. So when people have bleeding gums and diabetes, if you clean their teeth and get rid of the bleeding gum, get rid of all the infection, then the diabetic marker goes down. And that's some insurances now even cover to get 4 cleans a year because it cycles with the diabetic marker. So that would be like right in here. You could see where it's swelling, where the gums would be bleeding at. You can see the changes in the tissues right here. And then after it's cleaned out, you can see how clean the roots look. They have bone loss. You can't get that bone back. It's just gone. But when the bone is eating, this is like maybe 50% bone loss down here, or a little bit more. But when it gets to like 75%, the teeth are really loose. They just sometimes fall out on their own. That's how bad these infections are. And infections where if people have toothaches, then those type of infections are a little different because the infection is at the tip of the root. And those infections are found a lot in heart attacks. And I'm talking high, like 75%. So it's important that you ask patients or ask your doctor if you're the patient, but if they should ask you, do your gums hurt? Or do your teeth hurt? Do your gums bleed? Are you chewing your food comfortably? Especially the older that you get. This is another one where it shows like crowns on people's teeth. When you have crowns on your teeth, it's a 360-degree barrier between that tooth and your gums. So a lot of times if that crown isn't fitting totally 100%, you're going to be getting swelling in between the gum. You'll be getting bacteria here. And if you're not cleaning it well, if you're not flossing properly, most people don't even know how to floss properly. I'm going to say 90% of new patients, and I don't care if they're 10 to 90, they've never been shown how to floss properly. 90%. So if they're not flossing properly, they're not getting the bacteria out while it's soft. So when you brush your teeth in the morning, you're getting the bacteria off when it's soft. If you don't floss, you're not getting it out from under the gums while it's soft. So it starts building up more and more and turns into tartar, which is bacteria that is very deadly to the body. But as you can see, these people will have more tendency to build up bacteria because of the interface of the crown and the gums. This is a advanced periodontal case. So you could see, like this person, you can see all around the gum line, you can see tartar. All here is infection. And this is the same type of infection that you would go to the doctor for. So I always tell patients, if you wash your hands and they bleed every time you wash your hands, then you would be running to the doctor. Like, what is wrong with me? I'm bleeding every time I wash my hands. They bleed every day and they do not go to the dentist. And it's the same infection. It's going to do the same thing that it would do to your diabetic marker or your heart attack marker or anything. If you have an infection, an infection is an infection. So all of this is tartar, and you can see how the gums are pulling away from the tooth. You have inflammation here. You have a lot of tartar here. So when we clean that, we're going to see the root because it's already eaten all the bone away from that tooth. And it's a silent disease. People don't even feel it. But like something like this, if they might have a mouth odor, and that would mean they need a deep cleaning. And so when you do clean it all off, you could see root area here. You could see this tooth, period, because on the previous slide, you can't even really see the tooth because there's so much swelling there. So you already know, I can look at this and tell how much shrinkage I'm going to get, how much bleeding, how much infection is there, and what we need to do to clean this. The problem that we have in community clinics is that they don't do this. They don't clean these teeth. They will polish this and keep on going. When I got back from doing research in 2013, I went to a clinic and I was like, I'm going to give them some private care and see what happens. So when I interviewed with the director, he didn't even know. So it's a problem with not only medical, but dental as well, because dentists don't even know what this stuff is doing to the body. So it's a real big disconnect. But I told the director, and it was 8 clinics at the time, I said, I don't polish bacteria. So I'm going to tell you that right now. And he was like, oh, well, we have, our plans don't really cover for deep cleanings. Like, how you don't cover to get rid of infection? A cavity is an infection as well as a bacteria is an infection. We get rid of that. So why wouldn't you get rid of this infection? And he says, well, most plans don't really cover it. So we just don't do it. There's no such, and I told him there's no such thing as a regular cleaning when they have all this infection going on. You can't just clean the surface and leave the infection that's, killing them. And so 2 days later, because I know he wasn't telling the truth, but 2 days later, he gave a message to all of the dentists and told them that they have to start doing deep cleaning. Start. That means these people, it was heartbreaking. When I saw these patients and compared to my patients, it was like night and day. My patients looked like privileged people compared to the people in the community. It's really, really sad. It was to the point where I could tell people that they were diabetic. I'd be like, are you diabetic? They'd be like, oh, how did you know? I'm like, I could tell by how their gums would bleed. I could almost touch the gums and they would bleed. And so it's really bad. But the doctors were mad. They were like, I don't know why all of a sudden we got to do all these deep cleanings. So it was, but they didn't know it was me that made them have to do it. I don't know if they still do it because I haven't done that in a long time. But it's something that needs to be, it's a concern. It's a concern of mine. And I just want it to be public knowledge. So that's my whole goal, is that this oral systemic connection is public knowledge and people are aware, and they're aware of what a good cleaning is. I had a woman come in the other day and her teeth were not bad. She had been getting cleanings and stuff, but she had stopped a little bit, after the pandemic or something, but she's a good flosser because she had braces before. So when I cleaned her teeth, she was like, oh my God, I never had a cleaning like that. And most of my patients will say that, because it's not a 15-minute cleaning. When you work at the clinics, it's like 20 patients a day. There's no way you could do this cleaning in 15 minutes. So this would take like 2 hours and sometimes 2 appointments. But with the clinics, they would give them 15 minutes per quadrant. So they would have to come back 4 times to get this clean. That's the clean. Okay, the bacteria testing that we were talking about is something that you could do actually in your office as well. It's called oral DNA, and it's a 30-second rinse. So you swish around the saline in the patient's mouth for 30 seconds, swish, gargle, spit, and then you get a reading of these 11 different bacteria. And there's a lot of research on these bacteria. These high risk pathogens, these lines right here just tells how much you have to have for it to start eating your bone. But it doesn't say, because the research is so it's not a amount on how much it takes to, you know, harm the body. But you have this much, as you know, it's eating bone, so it's doing harm in your body. But so this would be like a test that we did, and we'll say, oh, you have this is highly related to dementia, you know, you better get this one down, you know, that kind of thing. And some of them are like in your body, so you would not totally get rid of it, but you can get it really low. This would be like an 8-week follow-up, and you can see some of them they still have, but for the most part, a lot of them are just totally gone. And that's an 8-week follow-up after their deep cleaning. Well, I don't want to end it. So this is like a report that I would give them, but now the report actually comes on the test, but it doesn't have some of the research on there, but it does have like generalizations on there. So it'll say like this one is found in aneurysms, heart disease, dementia, Alzheimer's, diabetes. This one is found in rheumatoid arthritis, heart disease. Like a lot of times you'll see a theme, like you have a whole bunch that say rheumatoid, and that person will be like, yeah, I have rheumatoid. And there is studies that show that rheumatoid arthritis, some people think it's 100% triggered by oral bacteria, because they find oral bacteria in 100% of the synovial fluids in the joints of rheumatoid patients. So you can see different cerebral aneurysms. This is a rheumatoid, Alzheimer. Some of this is like bacteria that you would find in your mouth anyway. But at certain levels is when it starts getting destructive. So this was an event that I did. So I just put this little slide in there about breast cancer and breast cancer awareness. And 1 in 8 women will develop invasive breast cancer. 1 in 2 American adults have some form of gum disease. That's half of the population. So half of the people are going to get some type of gum disease. Sometimes it even just comes like in menopause, where all of a sudden their gums are bleeding, their teeth are shifting. They're like, oh my God, you know, and we have to get on it. Women with gum disease have a 14% increased risk for breast cancer compared to women without gum disease. There's a 30% risk for women with gum disease who smoke or smoked in the past 20 years. So gum disease and smoking are bad for everything. You guys already know smoking is a confounding factor of everything, basically. And this one, okay, we're going to talk about sleep apnea a little bit. There are appliances that we make for sleep apnea, and they're called oral appliances for sleep apnea, or oral OSA appliances, or MAD appliances, mandibular advancement. So the difference between an oral appliance and CPAP machine is that the CPAP machine forces air into your airway. The sleep appliance opens up the airway, so it's no forced air going in. And with mild to moderate sleep apnea, which would be a AHI of 30 or less, they can get an oral appliance right away, and most medical insurances will pay for that. We're signed up with Medicare and all other major carriers for the sleep apnea appliance. So the AHI is when someone stops breathing for 10 seconds or longer. That's 1 AHI per hour. So there's people that stop breathing for 10 seconds or longer 30 times an hour. They would be severe. 15 times an hour, there will be a moderate sleep apnea patient. There's people, I've seen one test came through and hers was 81 times an hour. How do you stop breathing 81 times an hour for 10 seconds or longer? And I've seen some, they stop breathing for like 50 seconds. And that's when they'll start gasping, like people that sleep and gasp. And so they really need to see someone and get tested for sleep apnea right away and get an appliance or a CPAP machine. So as you can see, sleep apnea, they have a higher risk. It's the same thing, that it's almost the same thing like gum disease. They have a higher risk for heart attacks, higher risk to develop diabetes, the higher risk for obesity, anxiety, so many things. Sleep apnea is another, so you're not getting enough air in your airway, so it's leading to not dementia so much, but like forgetting things and stuff like that, brain fog, that kind of thing. So gasping for air, nightmares, insomnia, these are the signs that they would have. Anxiety, depression, chronic fatigue. So somebody that's always tired, they wake up and they could take a nap again. They fall asleep. Some of them even fall asleep at the stoplight. So that's one of the questions on the Epworth test. So what we're trying to do now is to get more physicians to screen patients for sleep apnea. In New York City, they just passed an ordinance where every resident gets a free sleep test because they know it's so underdiagnosed. And it's so, they need to see how, this is another risk factor that doctors don't check, and they should. And so there's easy ways to do it. There's the Epworth test, which is the most common one, but the stop bang test is the more reliable one. So research shows that this one, if they answer questions on the stop bang test, if they get 3 or 4 yes responses, then there's more than likely they do have sleep apnea, but they would still need to take a test. These are other consequences of sleep apnea. It increases your risk of stroke, asthma a little bit. There's 38,000 cardiovascular deaths annually, hypertension, 39%, coronary artery disease, 30%, congestive heart failure, 140%. So when people like die in their sleep and people think, oh, that was really peaceful, they died in their, they suffocated. So it wasn't peaceful. But one of the things that when you get sleep apnea treated is some of the weird things, well, I would say weird, but things that you wouldn't expect is this one, frequent urination at night. They will stop going to the bathroom. So they'll be like, oh my God, I used to go to the bathroom 4 times a night, but since I started this appliance, I don't go to the bathroom anymore. So they're resting, and they're getting the cellular healing that they need to get during the night, during sleep. So a lot of these are loud snoring. That's a sign of it. Mood disturbance. You know, somebody always evil. They probably just not sleeping good. Loss of alertness, daytime sleepiness, diabetes is another one. And of course, obesity. So this is a stop bang. And this is what is your sleep apnea risk? And do you snore loudly? Are you tired? Do you feel tired, fatigued, or sleepy during the day or when driving or talking to someone? One of my patients, she was like 28. She's been coming since she was born, basically. And I had her do this. And I had her do the Epworth because they asked you to fall asleep at a traffic stop or something. And she said, yeah. I'm like, what? She's like, yeah, sometimes I'm on the freeway and I just feel the bumps and I wake up. And I'm like, oh no. So first of all, you need to stop driving until you get this taken care of. But funny thing is that now that I think about it, she had a stroke a couple of years ago. She was at work and she felt like she was going out. She called her dad and her dad's like, go to the hospital. The hospital was right across the street. And she had a stroke. But they said it may have been related to the birth control she was taking. But now that I'm thinking about it, with her telling me this, it could be related to her sleep apnea as well. So another one is, do you have high blood pressure? Now, one of the things that is a red flag is resistant hypertension. If someone has resistant hypertension and they snore, they need a sleep test. So that's the only exception I would put on here, that it would be 2 things instead of 3, because resistant hypertension, there's a lot of studies on that, how it is related to sleep apnea. The body mass index, age older than 50, neck size. We measure the neck size. We have, the measurement for the neck, but men usually know theirs because they know their shirt size or whatever. And gender, male. So you're low risk if you answer 0 to 2 questions, intermediate risk if you answer 3 to 4 questions, high risk if you answer 5 to 6 questions, or yes to 2 or more plus male gender. And I would say two or more. They said 2 or more plus BMI over 35, but they asked you that already, BMI over 35. 2 or more and neck circumference, they asked you that too. So, but I would say 2 or more and resistant hypertension. So untreated sleep apnea can increase your risk for heart attack, stroke, high blood pressure, diabetes, obesity, driving accidents, and death in your sleep. So this is our number that we use for the sleep apnea business. And it's in the same office, but we do that on we do that on Wednesdays and Fridays. So anybody have questions?
First of all, thanks so much for this. I learned a lot, especially about resistant hypertension, doctor. So you've taught us a lot. Thank you so much. So, Dr. Tamora Dixon, you're with us. You want to comment any further? Anybody have questions? Is there anything in the chat, Dr. Neighbor-Stephens?
Not right now.
You make sure Dr. Dixon is muted.
I'm open for questions if anybody has any questions.
So can you relate dental health to high blood pressure and how that resistant hypertension is made by a dental infection?
Well, it really wasn't for the dental infection, it was for the sleep apnea. So
Okay.
that, so the interrupted breathing, and they also measure blood pressure during those tests. And they find that people who have resistant hypertension and undiagnosed sleep apnea, their hypertension improves with sleep apnea treatment.
So one of the questions I know was on the previous time you were with us, and this has been so good, was about the coconut draw. Dr. Neighbor-Stephens, you had asked about that, I think, the last time.
MCT oil, not coconut oil. MCT
Yeah,
oil.
MCT. MCT
What's
is a medium.
It's what?
It's a medium chain triglyceride that's been shown to help with dementia.
Mhm.
And so they had a woman do a TED talk on it, and she was really, really good. And she had used it doing research to treat her husband. But I've had people that have used it and have seen improvements in their loved ones with dementia. And some of them were not even early stage dementia. Some of them were later stage dementia that they saw improvement with.
I wanted to go back to the beginning of the problem and prevent it. I understand that you that you can do the deep cleanings and all, but what should we be doing every day to help prevent it from happening in the first place or to diminish it?
So to diminish it and to prevent prevent gum disease, it should be a household habit to brush, floss, and rinse. So teaching the kids, I think it's important because when they get the early habits early on, then they seem to have better outcome, better teeth for longer life. Your teeth should actually last you your whole life. And so if you're flossing properly, brushing properly, then you should have your teeth forever.
We have two hands up. I don't know whose hand went up first, but they are Dr. Sherrod and Dr. Kerwin Dawes. And we also have a question. This is to you, Dr. Maxey. You mentioned resistant hypertension, and one of the members of the audience wants to know what is that.
Okay, let's go with the two questions first.
I'll yield to Dr. Dawes first.
Okay. I was asking about the cost of the apparatus. I see a fair amount of possible sleep apnea. I'm in Jamaica in this. We have a big increase in obesity. In fact, we lost a 30-year-old on Thursday who was over 500 pounds that had a stroke and then through a PE. I transferred to ICU yesterday and we're trying to get him a BiPAP machine, a 26-year-old who was over 400 pounds. A lot of them are saying they can't afford the testing in Jamaica is very expensive, which is one of the problems. Even if we bring in the machines from abroad, how expensive are the dental apparatus? And is there anything that we can, because we're seeing a big increase of obesity and sleep apnea in young people with strokes and hypertension. I have a 16-year-old who is now diabetic and we think he has sleep apnea. And the boy is like 240 pounds.
So one of the things that you could do is for the screener, the stop bang is really good because it's more predictive. And since you're saying about the obesity, that is a big factor as well in sleep apnea. So the devices, I'm not sure how you would get them out in Jamaica, but they're
not available now because I know a fair amount of dentists. They would have mentioned them.
Because they can learn how to make them. The dentists can learn how to make them, and or the dental labs can learn how to make them, and the dentist can learn how to treat the patients with sleep apnea with devices. So, and it depends upon the device, how much they are, because they go up to like really high. It depends on it depends on what coverage they have and how much the coverage is for that particular code. But it's a treatment.
That is the weight of the chest versus the oral cavity.
How much is the what?
How much is the sleep apnea caused by the physical weight of the chest versus the oral cavity? Is there a difference?
It's not the chest, it's more of the tissues inside the mouth before you get to the airway. So it's above the airway. So a lot of times when they're obese, they'll have more tissue in their soft palate that's looser, that's blocking the airway when they sleep, especially when they sleep on their backs and that kind of thing. So it really varies by patient, but it really doesn't have anything to do with the chest.
Okay.
Can
Rod?
I
yeah.
ask, in reference to Dr. Kervin-Dawes' question, I don't know much about this. Are the appliances, do folks have to be measured and molds made in order to get the appliance, or can you
Yes.
send, you can't just send small, medium, and large appliances and have the
No, they have to be made specific to the patient. So it takes into the account their dentition, their accurate dental model of their teeth, and the appliances made on their teeth, and the positioners reposition them until their airway is open to maximum improvement.
Yeah, Dr.
So it's a
Maxey,
whole treatment.
Dr. Maxey was just going to send a whole boatload of appliances, but we can't do that.
Oh, that would have been so nice.
I'm serious. I know that's where we're going. So I just wanted to make sure that I understood what the opportunity was.
They do have some over-the-counter appliances, but they don't really work that well.
Okay. Thank you.
Yeah, I just want to, I want to thank you so much for this very informative talk. I wasn't here at the early introduction, so are you a dentist or?
Yeah.
Okay, so Dr. Dixon, can you talk a little bit about oil pulling and its relationship, or whether it's effective in affecting gum disease? And also, I'm aware of that TED Talk that you talked about where it was a pediatrician who actually reverted she reverted the Alzheimer's in her husband using MCT oil. I think it was like 24 milligrams a day. I don't remember exactly, but I saw that same TED Talk. My other question is concerning the sleep apnea and what differentiate whether you get the CPAP machine versus the appliance. This is my first time hearing of the appliance. What determines whether, and I think you said it, but what are the criteria for not having to have the CPAP versus the appliance?
Okay, well, the oil pulling question you asked, yes, it is effective because it does attack dental bacteria when they swish it around in their mouth. So the oil pulling, as you know, is like just swishing the oil around in your mouth. But this at the same time, the reason why that TED Talk made sense to me is because I know that oil pulling is good for the teeth. So when you swallow, the oil is going through your system, and I'm not surprised that it helps with some of these dementia patients because they have oral bacteria found in dementia. And for your question on the CPAP versus the oral appliance, the recommendation right now is that oral appliances are most effective for mild to moderate cases. So if you have a mild to moderate sleep apnea, the oral appliance is 100% as effective as the CPAP. If you have if you have a severe case, which is over 30 for the AHI, then the oral appliance is the second choice. The CPAP is the first choice. If they're CPAP intolerant, they can get a oral appliance, which is still like 88% as effective as the CPAP on severe cases. And I've seen some severe cases where it's actually 100% as effective as the CPAP.
And one other question, and maybe you covered this earlier because I apologize for coming on late, but how often should you be getting your dental cleaning, just regular cleaning?
Well, it depends on the person. It depends on how
Right.
much you're building up. So I have some patients that come every 3 months. I have some patients that come every 4 months, and I have most patients that come every 6 months. But if you have a periodontal patient, which means that you build up more bacteria, some people just naturally build up more bacteria. They have a higher level of saliva, and people I found with increased saliva levels have more buildup. And then people who have drier mouths have more cavities. So that's basically how it goes. But it depends on how much you build up. Some people, I swear, they should come every month because they build up so much. So it just
And
depends.
right. The last question I have is concerning the new use of laser treatment in gum disease and peptide therapy. Are you familiar with either of those two?
I'm familiar with the laser treatments, and all that is good, but it starts at home. You have to have preventative treatment at home because you're going to be building up. It's from your body. So you can get all the laser treatments, the surgeries, the whatever treatment you want, but you're going to still build up. And most of the time, people that get those surgeries need them again if they don't change their habits at home or do something different. And so we have also,
Go ahead.
we also do what's called perio trays. And what they are is a custom made appliance, basically, that goes over your teeth that you put a peroxide solution in, and it helps keep the bacteria levels down.
Are you familiar with the excess or the increased risk of gum disease in people with fibromyalgia? Have you?
I haven't really done a lot of study on autoimmune diseases or anything like that, and oral bacteria. So no, the only thing is rheumatoid that we really find it in because of the increased bacteria in the synovial fluids of the joints. But
thank you so
that could
much.
have something to do with it too.
Yeah, it's a wonderful talk.
Thank you.
That's Neighbor Stevens.
There's a question to Dr. Dixon regarding what are your thoughts on teeth whitening and any suggestions for toothpaste for sensitive teeth?
They have a lot of toothpaste for sensitive teeth, which are over the counter, like Sensodyne and stuff like that. And I've been whitening teeth since probably since I started dentistry. So I don't find a problem with teeth whitening. But for the sensitive teeth, if we have somebody who we have sensitive teeth, we'll give them a prescription. A lot of times it's a prescription fluoride for them to use for a couple of weeks to desensitize the area. So if it's a dental problem, then we can give them a prescription for that.
Any other questions, comments? So I'm really interested in that medium chain triglyceride pool. Can you talk a little bit more about the mechanism of that and how it can potentially help in dementia?
Well, the oral pulling, the pulling is more for decreased dental bacteria, but the MCT oil is ingested. And so it's like a tablespoon a day or a tablespoon twice a day if they're symptomatic. And within a month, you'll see the difference in that patient. And I believe because it's destroying the dental bacteria that's in the dementia, if that's one of the causes of the dementia.
If I may interject, the amount was actually delineated in that TED Talk, and what I remember was like 24 milligrams of MCT oil, which is medium chain triglyceride oil per day. Now, it may be less or more, but if you Google the TED Talk on YouTube, Dr. Maxey, and listen to the whole thing, you'll see the process that this lady used to reverse the Alzheimer's in her husband.
And also in that talk, it was a lot of, that talk was really old, and there's a lot of more new information. And she was just using MCT oil that you can get at the store, like to cook with. She wasn't really using, she was using coconut oil. And there's medium chain triglycerides in the coconut oil.
Correct.
But since they have kind of like got it down to how much actual MCT oil is, it's helpful.
Yeah, and it's a simple thing to do.
Yes, my grandmother does it every day. She's been doing it for probably 8 years now.
Wow.
And she's 103.
Wow. Amazing.
Yes.
Dr. Wilkes?
I see a hand up, Dr. Dahl. Dr. Dahl has a hand.
Is Dr. Wilkes?
I will yield to Dr. Dahl.
What I was saying, routinely in Jamaica, if they can afford it, but we use a higher amount of, we use cold pressed coconut oil, and it has to be cold pressed. And it use actually 10 to 15 milliliters 3 times a day. So we use actually a high amount. And
that would be like 3 tablespoons, because a tablespoon is like 15. Yeah.
So we actually use about 2 to 3 tablespoons 3 times a day, because a lot of times they can't afford the Alzheimer's medicines anyway. And it does.
That's really good.
Pardon me?
That's really good. But do they have a lot of like digestive issues? Because sometimes when you use that high of amounts, you'll have a lot of diarrhea and stuff like that.
I haven't had, my last patient on it was on 2 tablespoons 3 times a day. They said they spread it on salads and different food. They didn't just drink it like that. They sort of on the foods throughout the day. And I have not had anyone had any complaint with it.
Oh, okay. Probably because it was
they sort of sprinkling it all over different things during the day. And it's routine here for most people to put it in their coffee in their mornings. Pretty much what older people do. And it seems to help. I mean, we don't, I think we are getting more Alzheimer's now. And I think it's because we stopped doing a lot of the natural things we used to do. But as I said, my adopted mom died a couple of years ago, and she was 3 months short of 100 and totally sharp. And she did coconut oil in her, I didn't tell her to do that, in her tea or coffee in the morning, depending what she felt like drinking.
Mhm.
So,
Hello, Dr. Walks.
So thank you. And I'm going to have to run after I ask my very rudimentary, elementary question. Dr. Dixon, thank you for bringing so much scholarship to, to what my idea of going to the dentist is. I'm much smarter now, and I appreciate that. Now, after you were here the last time, I rushed out and got some organic coconut oil, only to find out that organic coconut oil is a solid at room temperature. So do I put a table, Dr. Mackey, please tell Dr. Neighbor Stevens to stop laughing at me. I'm doing the best I can. I went to public school. So I did go to USC though, Dr. Dixon. So I should be I should be smarter than this. When
I went to UCLA.
I went to residency there, but I got my underpinning. I root for the
That's
football
right.
team at USC.
Legitimate Trojan.
So if I take a table, both of my parents are USC graduates. So if I take a tablespoon of coconut oil, do I just put it in my mouth and let it melt? Please help me with that.
Yes, absolutely. You can do that. Absolutely. But you can also, like the other doctor said, you can also cook with it.
Oh, nobody wants to see me cook. Let me.
Oh, okay. Okay. Well, yeah.
Okay.
Yeah, you could do the tablespoon, and you could put it in your coffee too.
Okay.
Yeah.
All right. Thank you, Dr. Dixon. Dr. Dixon, there are a couple of things. One, yes, we can go see a TED Talk. Yes, we can learn stuff. But I think that a very important part of behavior change is how things are presented and inspiring folks to do things differently. So I appreciate your presentation. I appreciate, of course, the information. So thank you for being with us again. Dr. Maxey, I'm going to go and eat some bad food with Dr. Lawson, but I'm going to brush and floss afterwards.
Please do.
I'm told you only have to floss the teeth you want to keep.
Yes, sir.
Yes.
All right. Good day, everyone.
Yeah. Is Dr. Lawson
Goodbye.
not on with us today?
No.
Okay. Any other things in the chat we need to address, Dr. Neighbor Stevens?
Dr. Gibson asked about sublingual MCT, and having tried taking it, I don't know how you would keep it under your tongue, Dr. Gibson, but people know more than I do.
Dr. Gibson.
I think any way you take it to work, as long as you're taking it.
I'm just saying, I don't know how you would keep a tablespoon of MCT under your tongue, but
It would be more beneficial if you switch it around though, because it's also helping clean the bacteria in your mouth.
What does it taste like? Hopefully not
It
cast
tastes like
off.
nothing. No, it's
yeah,
see,
there's
that's
no
what,
taste.
there's no taste. My grandmother was hesitant at first because she thought it was going to taste like castor oil. And she remembered taking that as a kid, and she's like, no, I don't want that. But after she tried it, she takes it herself. It's the bottle sit right next to her bed with her tablespoon.
Is our pre-medical student identifiable? Can she ask a comment, make a question?
She had to leave.
Okay. When she's going to have the same meal as Dr. Lawson, Dr. Walks are going to have. Well, Doctor, we appreciate you for being with us today. Want to have final comments for us? We'd love to have you give us a final word for today.
I just want people to know that the oral health has a bigger part to play in systemic health than we're traditionally taught. And the reason why it is not common knowledge to physicians and dentists is because it's not on the boards. And we know these schools teach to pass the boards. So it's our own collective research and outside activities. And I commend all the doctors here today from taking their time out to learn something different and communicate with each other that way. I feel like all the doctors should have a reliable biological dentist that they work with, and that it's part of your screeners or your intake papers to your patients to ask them when is the last time they've been to the dentist, do they have a toothache, do their gums bleed? 3 like easy questions. And if there's yes to any of those, you can transfer them to your to their doctor. But also, if you suspect anything like that, as far as doing your evaluations, you can do an oral DNA test as well. And I'll just go more into that next time I speak with you guys and see what codes you can use to bill for those.
And I think it's going to be December the 14th. Am I correct?
Yes, December 14th.
Okay.
Dr. Gibson has his hand up, Dr. Maxey.
Dr. Gibson?
Yes, hi. Earlier, Dr. Neighbor Stevens asked me how on earth could I do, or could a patient do a sublingual? I think I recall Dr. Dixon saying that folks would put it in their tea or their coffee, whichever. Those are pretty easy to do sublingual and buccally. And I say buccal, that means like, in the between your
Cheeks.
yeah, right. You can do bit by bit, not a lot at once, just metered portions of the MCT, because it is, again, I think someone said that the room temperature is solid. So those are two suggestions I think make sense. I don't know. What say you, Dr. Dixon?
I just feel like any way you do it is going to be beneficial, because if it's not benefiting your teeth, it'll benefit your brain. So just ingest it. Just ingest it. 1 tablespoon is not a lot. If you don't have a lot of symptoms, I say 1 tablespoon. But if you're treating someone who's having symptoms, like I had a great aunt who was having symptoms, and it made me remember that TED Talk and go and buy the MCT oil. And we gave her only 2 tablespoons a day. And within 3 weeks, she was like back coherent.
Like Nike, just do it.
Just do it. It's a preventative measure, just like flossing your teeth. If you don't do it, then 10 years from now, you'll be losing teeth. But if you do it, you're actually preventing that from happening 10 years from now. You know what I mean?
Yes, and you are taking still new patients, we hope.
Oh, yes. I'm always taking new patients, always helping people. And I always pray that I get the patients who need me. That's why I like to reach out to physicians and see if they have patients that they're having problems with their diabetes marker, their heart attack markers, stroke markers, that type of thing. Dentistry is my ministry.
I love that.
Dr. Neighbor
I
Stevens.
made a shirt like that. Dentistry is my ministry.
Dr. Neighbor Stevens, final comments?
Well, I love the fact that Dr. Dixon looks at dentistry as her ministry. I looked at my practice of medicine as a ministry, so I think I understand what you're saying. And I want to again thank you for joining us today and sharing your information with us, especially since it is very easy to implement. We're not talking about giving yourself an injection every day. We're not talking about using CPAP every night. And we're just really happy that you came and shared the information. As you probably gathered from my comments, after the first time, I went out and got my MCT oil. But I got the MCT oil, so I'm not dealing with anything solid. And that was why I couldn't understand how you could keep that greasy liquid located underneath your tongue. But same breath, I want to say, it's very easy to swallow. There's no taste. And I even went out and got some shot glasses so that, I could just.
Oh, that's really good.
Take it down. Thank you.
I wanted to respond to the question. I do take Medicare. We're a Medicare provider. I'm a DME company for the oral appliances for the sleep apnea. So we take Medicare for that.
Well,
but all private plans for the dental plans, they're all PPO or higher. We don't take any Medicare plans for the dental part.
All right. Well,
unless it's a plan where you can go anywhere you want. Yeah.
Well, thank you so much. And my final word, I'll remind everybody that next week is Dr. Bryant, the psychiatrist who was with us several weeks ago. He's going to be speaking about the holiday blues. And then the following week on the 14th is going to be Dr. Tamora Dixon. And I want everybody to be happy on the holidays And don't forget to pray and give thanks. Have a great day. Thank you, Simon, so much. And thank you again,
Thank you
Dr.
for having me. Thank you
Bye.
for having me. Bye-bye.